Good afternoon and welcome to Community and Clinical Solutions to Lead, Session 1 of 2, Leaducation, a Focus on Water. My name is David Nelson, and I'm a professor of family and community medicine at the Medical College, and I'm so thrilled that we could be bringing this webinar to talk about lead in our community and solutions that we're working on. We're joined by a number of community and academic partners in this space. And at this time, I'd like to turn the floor over to my colleague and friend, Dr. Heather Parody of Children's Wisconsin, as well as the Milwaukee Health Department. Dr. Parody, the floor is yours.
Thank you, David. Good afternoon. Lead exposure is a pervasive issue in our post-industrial city, with a core housing stock that was built with lead-based paint, lead laterals, and lead solder. While we know that the primary source of lead poisoning at a population level is lead-based paint and dust, today we will focus on a secondary source of lead poisoning, lead in water. Here in Milwaukee, we are blessed to have a safe, stable drinking water supply that we can depend on. Community-level factors like those that happened in Flint, Michigan are highly unlikely to occur here. That said, we continue to be a city with tens of thousands of lead service lines in need of replacement and other possible interior sources of lead in water. The EPA, or Environmental Protection Agency's lead and copper rule, since 1991, has placed regulations on allowable levels of lead and copper in our water supply. Additionally, President Biden's bipartisan infrastructure bill places an emphasis on clean water infrastructure and lead laterals. With this funding, we shouldn't have to wait generations for these changes to occur. And there are multiple ways that we can each equip ourselves to ensure safe drinking water for ourselves and our families. I'd like to present today's panelists for the webinar. We have Richard Diaz, the chair for the Coalition on Lead Emergency, or COLE. Shaquita Miguel Roy, a parent advocate with COLE. Brian Rothergy, Marketing and Communications Director with Milwaukee Waterworks. Michelle Natarajan, Water Quality Manager with Milwaukee Waterworks. Sharon Adams, Executive Director, Community Water Services, LLC. And Franklin Cumberbatch, Vice President of Engagement at Bader Philanthropies. Michelle Natarajan from Milwaukee Waterworks will now be reviewing the problem a bit more in depth prior to our panel discussion. I'll pass it over to Michelle.
So as Heather said, I will briefly review the overall problem, why we're all here. And I don't want to dwell on this too much because I think if you logged into this call, you are most likely aware that lead is a problem. And so this slide is just meant to quickly highlight the main impacts that the CDC has identified with lead. As it is, of course, especially damaging to developing brains and developing children. So this highlights some of the learning and behavior problems, hearing and speech problems, growth and development, things that have resulted from lead poisoning in children under the age of 6 especially. Next slide. The good news is that in the city of Milwaukee, the prevalence of these elevated blood lead levels has actually come down quite a bit in recent years. So as you can see from the graph, which starts in 2004 and goes till 2021, the percentage of, or the prevalence rate of elevated lead levels has gone down quite a bit. But the bad news is that, of course, we do still have too many children being exposed to excessive amounts of lead. So in 2021, for example, there were 305 children in our city that had more than 10 micrograms per deciliter of lead in their blood. And in 2021, that same year, over 1,000 children had more than 5 micrograms per deciliter. And I just want to highlight that micrograms per deciliter is a way that we measure lead in blood. It does not directly correlate with how we measure lead in water. So I don't want to cause any confusion with that, but in terms of how those levels are selected, ideally we would have all children have 0 lead, but unfortunately we live in an old industrial city and there are many potential routes of exposure for lead. And so as a more realistic approach, we take a look at the average lead concentration in children's blood in our community. And then based on that, we try to use our resources to target the children that are above that average. So that level that we're targeting does change over time based on the resources we have available and our average community exposure. All right, next slide. So today we're going to focus specifically on water. Water, as Heather mentioned, may not be the main source of lead, but it could be a significant source. All sources should be eliminated. So we particularly want to talk about water because for children who are most vulnerable to lead poisoning, they may be more exposed to risks from water based on the fact that they consume more water relative to their body size, and their bodies may absorb more of the lead that they consume compared to how an adult's body might process that same lead. And especially because when they're under the age of 6, that is when some critical development is happening, and that is when they're most susceptible to some of the major impacts from lead. So that's why we're focusing on water, and that is the approximate contribution is estimated at 20%. Next slide. Okay, so just going over some of the sources of lead in our water. Of course, many of you have probably heard of a lead service line. I'll go on the next slide into detail more about what that is exactly, but that is one potential source. There's also potential sources within our internal plumbing. It can come from types of solder that's used to connect pipes within our plumbing that contains lead. It can come from faucets. Unfortunately, it was actually quite recently, I believe it was 2014 when it was, the law was changed so that faucets could no longer contain lead. So it is possible that some older faucets in homes do contain lead. And also it can even come from galvanized pipe, which doesn't itself contain lead, but it has the potential to absorb lead. So if there is galvanized plumbing in the home and there is also a lead service line, or even used to be a lead service line, some of that lead could have transferred to the galvanized pipe and then could slowly leach into the water over time. So these are all potential sources of lead in and near the home to get into the water. Next slide. So this image is just to help highlight exactly what a lead service line is. You can see underneath the image of the car that there's a circle to represent the water main that's running parallel with the street there under the road. And then to connect that water main to the home, we have a series of pipes. There's what they can call the gooseneck, kind of the funny shaped pipe that does the direct connection between the water main and the rest of the service line. And then there's the actual service line, which is split into 2 sections. Between the gooseneck and the curb is called the public side, which is owned by the city. And then between the curb and the meter entering the home, that's the private side, which is owned by the homeowner. So both of these sections have the potential to be made of lead. And unfortunately, in the city of Milwaukee, we do have well over 60,000 lead service lines throughout the city because it is an older city, and these used to be thought to be a great plumbing material because they are so flexible and durable and long lasting. But unfortunately, we now know much better that they also are contributing lead to our water. So that's why we are trying to replace them, which we'll talk about a little bit later. And then of course, you can see after the water meter, it goes into the internal plumbing, which we kind of talked about on the previous slide. All right, next slide. I'd like to highlight a few key concentrations of lead just as kind of reference points to think about as we continue our discussion. So 15 parts per billion is the EPA action level. Of course, like I said before, ideally we have no lead, but realistically that is very challenging to reach since we are an industrial society and there is tiny bits of lead kind of all around us in some form. And so the action level is basically a level where the EPA sets a limit to say, this is something we think that water utilities can realistically meet that will protect health as much as we possibly can. And so that's the level, like basically the regulatory level that we have to meet, that our water has to be below 15 parts per billion. And specifically with lead, it's based on a 90th percentile measurement. So we sample a number of homes, and then we take the concentration at which 90% of our results are below that level, and that's what we report as our that they compare to the action level. Just a few things to note. We did talk about sources of lead coming from that service line and coming from internal plumbing sources. So I just want to point out that Lake Michigan water is typically less than 1 part per billion in lead, and the water leaving the treatment plant is also less than 1 part per billion. That is not really where our risk for lead is coming from. In Milwaukee, our risk is coming from those service lines and from internal plumbing. I also wanted to mention that on average, just like from our own testing, tap water tends to be on average 3 parts per billion, but don't take too much stock in that average number because it can vary quite a bit. Lead is kind of a tricky, complicated thing that gets into the water, and whether or not your service line is made of lead, whether or not you have lead plumbing in your home, those can certainly affect how much it varies. And also how frequently water is used and how long water is flushed before it's used can really impact it as well. Any disturbance to the service line. So if there's construction on the water or sewer line, if they're digging up the street right in front of your house, this could potentially shake loose some of the lead that is on the pipe. So these are all things that can impact that average. The good news is that we do have a corrosion control treatment that helps to coat the pipes and prevent the lead leaching as much as possible. And so that does keep most homes closer to the average, but it is not a perfect system. And at the bottom, I just added a little note to kind of re-emphasize that micrograms per deciliter is what we're using to talk about the concentration in blood. And I'm using parts per billion, ppb, to talk about the concentration in water to try to help separate them because they don't directly correlate. If you consume, say, a microgram of lead, it doesn't automatically all go into your blood. Some of it can be excreted, some of it can go into your bones. It's not a perfect one-to-one relationship. So I just want to try to clarify that so the numbers don't get mixed up. All right, next slide. Okay, so talking more about the concentrations in the water. This is a graph of our results related to the lead and copper rule compliance sampling. So this is not all of the lead testing that we do in Milwaukee, but this is specific to our compliance with the EPA's lead and copper rule. I would like to especially point out that in 1997, we started and finished, so you can kind of see where we started, and then by the end of 97, we finished implementing our corrosion control treatment. What this means is that we, after some studies to evaluate the best possible option, we started adding a food grade orthophosphate to our water that coats the pipes as the water flows through, so that when it goes to your home and if it goes through a lead service line or it goes through lead plumbing, the idea is that that will coat the pipe and prevent the lead from the pipe from leaching into the water. And as you can see, once we finished implementing that by the end of 1997, our lead levels did drop below the EPA action level and thankfully have stayed below it ever since. So it is overall a very highly effective treatment, but of course, for sensitive populations and homes that may have more lead or unusual circumstances, it's not a perfect system. And so that's why we do still want to remove all the lead service lines and eliminate every source that we can. And I also just wanted to mention that on the bottom of this graph, you'll see that the years kind of jump around. As I mentioned, this is all lead and copper rule compliance sampling. So some years we were required to collect multiple rounds of samples, and some years we were not required to collect samples, and these are all just related to that specific rule. So that's why you'll see some years with 2 different bars and some years with no bars. Just wanted to point that out. Okay, next slide. All right, and then finally, I just wanted to highlight some of our other testing. I'm not sure what happened to bar number 2 on the graph there. That's not how it looked on my end, but we do testing outside of the lead and copper rule compliance. So in 2022, we did some testing with lead service lines and also some testing without lead service lines. And I want to say, as you can see, but there's something wrong with the bar graph there. As you should be able to see, there are 3 bars for each graph, and that's because we do a 3-bottle testing program for this. Bottle 1 is collected after the water's been in the pipes for at least 6 hours. So that allows more time for the lead to leach from the pipes into the water as it's sitting stagnant. And then once that water has been flowing for about 45 seconds, then we collect sample 2. And that is intended to kind of flush out the internal plumbing and get the water that's been sitting in the service line. If it is a lead service line, hopefully that would highlight whatever is coming through the lead service line. And then we wait a full 3 minutes of flushing before we collect the 3rd bottle to give us an idea of how much lead can still get through even after you've flushed the water, and you're getting water from the water main. And so hopefully it's not picking up as much along the way. As you can see from the graphs, all of the results were, all of the averages were below 5 parts per billion, which is a good sign. The internal plumbing, which is represented by bottle 1, was certainly higher for homes that did not have a lead service line, which makes sense that that's where the majority of your lead would be coming from, is from that first draw sample that's been sitting in the internal plumbing. And then for homes that did have a lead service line, unfortunately, the graph isn't showing up right, but the second bottle should be the highest there. So that is the end of my review of, I guess, where the problem is at and what our current concentrations are. And I will pass it back.
Thank you, Michelle. That was really a very interesting overview of what we're doing, the issues that are at play, as well as the solutions. And I was thrilled to see the idea that public health practice like corrosion control really does make a difference in our community. I want to bring in Sharon Miguel Roy at this time. As a parent advocate for coal, Shai has been in this area for any number of years, and she has been on our program before. And Shai, it's so good to see you again. How are you today?
I'm doing pretty good. In yourself?
I'm doing great, thank you. Could you tell us a little bit about who you are, your engagement with coal, and your work in the area as an advocate for parents and community for children and families exposed to lead?
Absolutely. So I'm Sharon Miguel Roy, and I am a self-advocate and also an advocate for my child, as well as other parents that are suffering from lead poisoning inside of their family. I originally started out with coal on a volunteer basis, teaching children about the exposures and dangers of lead inside the home and what they can do to identify it, and just educating children on how that looks. My journey though with lead poison did not start that early. It started earlier than that, when my own son was lead poisoned at the age of, from a newborn all the way up to the age of 5. His levels reached as high as 9.9 micrograms per deciliter, which brought him to suffer from a couple of different things, cognitive and educational delays, as well as hearing problems, vision problems, and behavior issues. It was scary. It was very scary. I received that news from the WIC office when we went to his WIC appointment, and that was it. It was just like, he has these lead levels. It started out at 5 micrograms per deciliter and gradually went up from there. After long deliberation with his school, after it was advised to me that he should repeat K5, that's when I really started to in-depth identify and learn the dangers that my son had to face. And I thought that, again, it was going to be something that could be cured, something that would go away. But no, even fast forward to now, he's 16 years old. He still lives with this today. So that is one of the main reasons why I wanted to be a part of COLE, to warn other families so that other children don't have to go through the things that me and my family went through. And there's a lot of parents, the first thing they say when I ask them, do they know what lead poison is they don't know. And the reality of it is that we think, when we put our trust inside of our doctors and the nurses that give us these tests and tell us our children are being exposed to lead, we look for them to give us advice on what to do next. And that's not the case a lot of times. But that's where Coalition on Lead Emergency comes in, because we want to find those parents, we want to educate those parents, we want to give those parents the tools that they need to do the things inside the home that they can do to make sure that this doesn't happen and don't continue to happen to their family to this extreme. I have been talking to families for the last 2.5 years through working with Coalition on Lead Emergency, and we have grown to over 200 families that we have either serviced with a water pitcher or a lead safe kit, or just sat down and gave them education on what lead exposure is. We have a number of families that we have took through a training, and that training is a 2-day training that consists of the first day, strictly education. So the later the paint, the water, the soil, and nutrition, which is a huge portion of it. A lot of folks in some of these lower income neighborhoods are denied access to the proper foods that their children need to eat in order to absorb the lead out of their system. So educating parents is definitely number one and the biggest thing key. And the second day is, how do you have that conversation with another parent? So we don't want to stop the train right there. We want the train to keep going. We want a parent just like myself to educate another parent, to make another parent aware, whether it be their neighbor, their cousin, their sister, their brother, just getting the word out there to folks who are really in need, in desperate need of these resources and the attention that their children need. Outside of that, we have monthly meetings with parents, and every month we have a meeting. We make sure we cover a subject because, like I said, there was no instruction on where do I go from here after my son's been up lead poisoning. How do I deal with the disabilities that comes along with it? So a lot of parents don't know that their children need an IEP, how to do that IEP. A lot of parents don't know how to ask the doctor to test their child, which is another really big factor in this. We don't know there's a problem if we don't go and identify the problem. And asking our doctors to test our children for lead poison on those well child check visits are definitely critical and important. And a lot of parents need help walking through that process. So we make sure that we help them with that process. The other portion is being there at these community events where they're a day of picnic in a park, or whether it be a Juneteenth event, or anywhere that we can be to make sure that we're reaching the maximum amount of parents in these environments and in these situations. Through my experience with working with Cole, it has been tremendous on how our voice is finally being heard. There has not always been the greatest relationship between entities like the health department or trusted entities that we look to resolve these issues. But through the work that we've been doing with Cole, the transparency has been becoming more clearer. And transparency is everything. So to sit down with a group of parents and the health department to come up with a survey to make sure that these kits are getting out to the community is huge, because the community can see that now there's more people that are listening. There's more entities and resources out there, and there's more attention being drawn to our children like they deserve and like we've been asking for. So I think that the biggest chunk of the work that I do and the biggest chunk of the work that Cole does is all from the parents, all from community advocates, all from self-advocates of parents that have been concerned and didn't know that they had this concern until they were educated on what lead poison is and gave the opportunity to actually do something about it. Being that we had the COVID and there was a back order on a recall, on the supplies to do the testing. I think that places like the health department, other partners that we work with, have been tremendous in making sure that the transparency there, and it's very clear that we are all desperate for this equipment to make sure that children are getting tested. And now that that problem has been solved, children have been getting tested. It's like at the topic of discussion in all of our meetings. And I really, really appreciate that, because like I said, if we don't know there's a problem, then how can we fix the problem? And so I think the biggest goal now moving forward is just to continue for parents to have a voice at places like the Joint Finance Committee meetings and with our elected officials, to let them know that it's a big concern of ours. And we really want to be in a place where our children get a fair chance at life without something that's out of our control holding them back. So I commend everyone that has been involved on the work that they have been doing, but above all, I commend the parents for being able to tell their stories, being brave enough to put the spotlight on their family. I know a lot of times in family settings, it's more so of a closed door type of ordeal, but the amount of families that we have willing to come forward and express themselves and tell their story, even my son, who is becoming a self-advocate and willing to speak out now and educate the youth and relate to others who have been going through the same thing is just tremendous. And I hope to see it grow and continue to be as awesome as it's been.
Shai, I just want to say, I get excited hearing you speak about your excitement over something that was tragic for your family. And you are a force, and I appreciate that. And I think that everybody does as well. I want to bring in one of our friends, our good friends, Richard Diaz. Richard, I got to have you come in and see, I know you'll do it, but let's give some love to Miss Shai and tell her what she means to the coalition, please.
Oh, definitely. It is always a pleasure to be even in the same room with Shai, with her track record of community organizing and agitation-based organizing, holding those, big institutional players and primary stakeholders accountable for the conditions of folks. Cole has grown substantially over the past few years, and Shai's ability to merit service with education and just everyday, getting the everyday person caught up to speed and best practices, but then also digging a little deeper with that individual, and Shai's ability to say, hey, don't you want conditions to be better for you and your family? Doesn't it suck that you went through this? Don't you want an opportunity to get in the same room with those decision makers and help create programs and offer feedback about implementation of programs? So Shai is our hero, and Shai brings such incredible value to our coalition. And Cole wouldn't be what Cole is without our value for capacity building for these parents. Now, Shai is so fortunate to be a trained community organizer that has legit wins under her belt, but other parents are just impacted folks, and Shai's leadership in teaching these individuals and how to be organizers is just tremendous, Dr. Nelson.
Let's talk about that, because you too are a community organizer as the lead for the Community on Lead Emergency. Talk to us a little bit about the importance of community organizing, engaging from the grassroots level to make a change. And I love that what you said, to agitate and to keep this at the forefront of people's minds, especially policymakers.
Community organizing is really the key to change, and I often talk about there's a huge difference between advocacy and organizing. Advocacy is being, someone who's willing to show up and, just cast the information broadly and, tell folks what they need to know. Whereas organizing is actually producing turnout. That's saying you are going to show up to something and you are going to get 3 to 5 of your close best friends, community members, or other residents and stakeholders to show up. And what Cole has done in our partnership with our parents and other community-based nonprofits. I see Sharon Adams is on the call with Milwaukee Community Water Services. Our ability to serve as a connector to entities like Milwaukee Waterworks or the Milwaukee Health Department, working with hospital systems like Children's Hospital to say, hey, this is where capacity is needed. This is what we are hearing from families. Although our families maybe don't have doctorate degrees or, college education, they have the lived experience that is most important with helping to shape policy. Policy is made to influence the everyday person, in which, college grads and highly educated people are the everyday person. But there are so many more who aren't, and so many more that are just unprotected in their ability to know where the issues are, and then also in their ability to be heard. What we want to do is provide that platform for folks to be able to share their story and tell their common council president, their alderman, tell their mayor, tell their representative in Congress, this is what I need to protect myself and my family.
Thank you, Richard, and even telling the Vice President and the President of the United States the importance of this issue. I'm gonna pull in Miss Adams, Sharon Adams. You are both an advocate and an organizer in this space, and Sharon Adams, the Executive Director of Community Water Services and formerly of Walnut Way, and someone who has been impacted around communities affected by oppression and by the idea that things aren't getting done. Tell us about community water services and the things that you're working on, especially the outreach component.
I'm delighted to, and I start by saying thank you. When I became so aware of the conditions, I reached out to Shai, I reached out to Richard, and what was so important was that they said I could come in. And I think it's just critical. It wasn't exclusive, it was come in, listen to our stories, and let's move forward. So Community Water Service is a very young, emerging not-for-profit. And I became connected to it because there's a group of volunteers who have talents in technology, engineering, and medicine. And they said, you know, we must find out if there is a way that technology can make a difference. And we're in the midst of that right now. And that's what I'd like to share with you. Just a few points. One is that we needed, and we'll know how testing makes a difference. And what I love about our testing program, it is the parents and the residents who are doing the testing. They are testing in their own homes, and they test over a number of weeks. You know, water changes, as was mentioned earlier so correctly. There could be a water event, but when you test for 7 weeks and you're testing and talking with parents in that home, they also become the advocate. They also become connected to Cole, and they're connected to us and each other. So testing is critical. The tests are taken at this time. The water collection is taken at this time to the University of Wisconsin, the chemistry department that runs the tests, but we also have a partnership with the health department. And so it's just growing those partnerships. The second big part of the area is that it's inside. You know, you've heard often and correctly today that there is issues inside the house, and those issues resonate with everything you've already heard. The internal plumbing, the faucets. When we go into a home, and we go into every home that we're connected with, and we see that the very same conditions of lead that will be removed by changing the lead laterals are in the older homes. They most often have lead pipes. The faucets aren't correct. And so, as been mentioned also, that's really key to us because our focus is interior. And I want to speak again about the technology. There's this little whole house filtration system that can be plugged in, and that means clean drinking water from the tap. Every time you turn on a spigot or water, your water will be clean, and we'll test some more. We have to keep testing to make sure that that's happening. I have 2 more points. One is about what I started with, this wonderful community connection. And in our beta project, what we're really looking to see is how we not only connect to our institutions, but how we get the referrals that are to the fuller abatement programs that are being run, such places as Social Development Commission, and that a parent, a homeowner, a renter is not asking, what do I do next? That there are organizations that are connected internally, also in terms of making sure that the blood testing can happen. And then there's the economic impact. I think that's so important. You know, we see as we scale up that there could be an assembly plant. There will be an assembly plant. There will be more community organizers and outreach. So there is an economic impact by creating not only employment, but also businesses. And I'd want to highlight those areas. In terms of what we're finding in our testing, we have run 336 tests, and that's in 87 homes, and 34% have elevated lead levels in the water from the tap. We consider anything that's 1 parts billion is elevated. I know that's below the standard, but if it exposes a child in a family, we consider it elevated. And that range, as been pointed out, sort of is around the 3, but it's also, we are going into homes where it's 19 per billion. It's not acceptable. And so that's our program. It's testing, continuing to test. It is providing the technology, which is a filtration system that is monitored. EPA has said that filtration systems, filtering works, and I believe it does. The issue, again, with technology can help. We can monitor to make sure that the filters are working right at the right time. We don't put all of that burden on a parent. And then we make sure that that they really are connected to each other, and that they're connected to our wonderful institutions that are working more and more with us and getting impact and results.
Thank you, Sharon. That was really, I love that synopsis and the idea of community connections. Brian, I got to bring you in as the Marketing Communications Director for Milwaukee Waterworks. I know that everything you've heard so far resonates with you, but what is your reaction to what Shai and Richard and Sharon is talking about, this idea of going to the neighborhoods, doing the testing, figuring out what the issue is, and working together to solve this problem? You're on mute. Brian, you're on mute.
Sorry, I wanted to give a huge thank you to Shai and Richard and Sharon for all the work they do. And yeah, just echo the importance of having folks who are directly impacted by this issue involved in the advocacy and organizing, because we know that's how real change happens. You know, when people who are directly impacted are the ones leading that effort. And I think the Coalition on Lead Emergency is a great example of that. And we're really proud to partner with Cole on our work to expand lead service line replacements. We want to do that faster and get more done, and go to the right neighborhoods where the need is greatest. And we also want to expand our testing regimen. Currently, we test at properties where there's a lead service line replacement scheduled, and Cole has been a great help in working with us to identify potential funding opportunities to expand the testing that we can do, so we can go beyond homes with lead service line replacements.
Thank you, Brian. Michelle, I've just got to ask you from a quality perspective, and I love the graph that you put up. I took a picture of it myself about the decline in lead exposure, and we know that we're not at 0 yet. What needs to happen in this space in order to continue to have that to drop over the series of decades, which we know that it will take that long?
Great question. I mean, I think as I mentioned earlier, with water being about 20% of the contribution, that is certainly a role. So I don't want to focus too much on other things today, because that's the focus of this webinar. Of course, you know, reducing lead exposure through soil and dust and paint and things are obviously a huge part of it. But in terms of water, I think replacing the lead service lines is a huge part of it. I think informing the parents, as Shai so clearly pointed out, the parents need to know what makes a difference. And the home, we have a lot of old homes in the city of Milwaukee, and so if we're going to bring lead levels further down, we need to address older fixtures, older plumbing, and the lead service lines. I think, you know, those are clearly the sources of water in our lead, and so the only way to really get it out or get it lower is to remove those as we've shown, we're doing the best that we can with our corrosion control treatment. We did a re-optimization study recently and confirmed that the levels that we're adding are the best that we can get. And so without removing actual plumbing, we're basically doing everything that we can beyond removing. So that's the next step.
Okay, I love that. And it tells us where we're at. Richard, I know that we're never satisfied, and you and the coalition have done a tremendous amount of work. Can you talk a little bit about what that has meant going all the way to the White House, our interactions with Vice President Harris, and the money that's being invested into our community?
Certainly. So first and foremost, the bipartisan infrastructure law provides, a once in a lifetime generation to water infrastructure across the country. And, the city of Milwaukee especially is extremely excited about receiving some infusion of capital into its general operating budget for its lead service line replacement program. Unfortunately, in the first year of bill, which was last year in 2022, bill meaning the bipartisan infrastructure law, two things happened that put Milwaukee at a deficit. The first is the funding allotment at the EPA level, in which the state of Wisconsin did not receive its fair share for how much money it should receive based on the scope of work and the amount of lead service lines that are in the ground. States like Texas, who are nowhere near Wisconsin in terms of how many lead service lines, got way more money. So happy to report the EPA has revised its funding formula, and the state of Wisconsin should receive more money moving into other fiscal years under the bipartisan infrastructure law. Second, the state Department of Natural Resources, who house the state revolving fund, the primary funding mechanism for water infrastructure work, didn't give Milwaukee its fair shake. On top of the city of Milwaukee not being able to have its fair share of shared revenue in the state of Wisconsin, utilizing the DNR as SRF is how we finance a lot of our water infrastructure work, specifically lead service line replacement. And, while the city of Milwaukee had close to 40% of all lead service lines, last year in 2022, we got 10% of all the money available, which is just unacceptable and puts, our mayor and puts Milwaukee Water Works in the spotlight as not doing their job, when in fact, they've gotten the short end of the stick. So, again, happy to report through some advocacy that Cole has done, partnering with Milwaukee Water Works and commenting on the state's intended use plan, which is the guidance document that kind of dictates how the money in the SRF is spent. The formulas have been rearranged. So moving into the next construction season for 2024, the city of Milwaukee should receive more money to operate its lead service line replacement program. And also, an interesting caveat. So when folks get their lead service lines replaced, essentially you take on debt, and water rates have to be raised in order for that work to be financed. The SRF is a loan to the ratepayer that they have to pay back. And through the bipartisan infrastructure law, 49% of that investment is meant to be principal forgiveness or subsidization or grant dollars for ratepayers. We look at the story of Flint and, the bad media stories and, how the parts per billion were, very well above the federal guidelines and the federal threshold. Now the city of Flint is paying some of the highest water rates in the country. So that principal forgiveness, that grant, that cost share elimination is going to be key, especially for vulnerable populations. In our conversations with Milwaukee Water Works, we have, encouraged a accelerated approach to lead service line replacement that invests in the neighborhoods that have been historically divested in, the places that have the highest elevated blood lead levels, zip codes like 53205, 53206, 53210, 53212. Let's prioritize these communities because these are the communities who need the resources the most. A neighborhood like Amani or Lindsay Heights, where the median income level is less than $20,000. David, how can somebody live off less than $20,000 a year? You know, it's just crazy. But you know, let's prioritize these communities that have that aged housing stock and that aged water infrastructure. Whereas, you know, a part of town like River West or Bayview, who has a similar age and housing stock, but has not been affected by lead in the same way. You know, that does not have the same rate of elevated blood lead levels like Amani or Lindsay Heights does. So we're very pleased with the communication, much like Shai said, the transparency between Cole and Milwaukee Waterworks and the relationship that we're building, but more support is needed. You know, Waterworks doesn't cut its own checks. You know, Waterworks doesn't approve its own budget. You know, that's something done by the mayor and the common council, which I think the mayor and the common council both in the city of Milwaukee are very aware of this and want to work to accelerate the program. We just need more resources, and we need to reevaluate what we are currently spending money on. So anything else you want me to touch on, David? I feel like I kind of went on a rant there.
You know, I will allow such a rant because it gets the message out. Shai, I got to bring you back because you are just such a joy to all of us. And I'm wondering if you could tell us a little bit about what it means to have a coalition surround a family with care and love and education, and to know that they're not alone in dealing with this issue.
It means the world for families. I get calls from families all the time. And I just want to clarify something. Like, I have experience in organizing, but I don't have experience raising a 17, 18, 19-year-old because my son hasn't made it there yet. And I meet so many parents who have children who are 30, who were lead poisoned, who still deal with the effects of being lead poisoned. So just like those families lean on me for how to talk to their doctor and so on and so forth, I lean on those parents as well. So it's kind of more so like a strong parent bonding group, because we all go to each other for those certain aspects. Like when my son was entering, for an example, when my son was entering into high school, he graduated 8th grade. I was so happy. I was so ecstatic because it was the best he had done since he had been in school, because he was virtual and he had time to really take his time and learn. And my son looked at me when he graduated and said, you know, Mom, I'm exhausted. I don't think I want to go to high school. And that was one of those moments where I had to look to another parent who had went through the same thing and experienced the same thing and be like, you know, where do I go from here? How does that look going forward? So the parents and myself as well, we look to each other and we depend on each other to uplift each other, to get direction from each other, and to really be there for each other. When it comes to one parent, I had to help her put duct tape on her windowsills because she had to be at work in 10 minutes. And she like, I just got the kid. I need to put this duct tape on because the kids is coming home. Well, I'll help you put the duct tape on it. So it's just those situations like that that we all depend on each other. And like they say, it takes a village. It definitely takes a village, because we scratch each other's back.
Thank you for that, Shai. Sharon, you put duct tape on windows. I know you have, and you've reached out to parents and given them the love and the care that they deserve. How do you encourage families not to give up in this space and in other things that you've worked on? You got it.
Okay, so it's hope and it's performance and trust. We had a person come in today from Hebetha Church wanting the testing. And there is a community organizer now who will sit and talk and listen and map out a strategy. And they know we'll show up. I think the other thing that I'd like you to say when I say hope, you know, when I spoke about technology, this system can be installed in a day. We don't have to wait for technology, for the process that we have now, so that a person is like, I'll do everything you say, but I'm still in danger, or you may not get to me. Funding is a big issue, but we're going to have to find a way that you give hope by performance. And so this system is changing people's lives, because once the system is in and it's tested again and a detectable level goes to undetectable, your performance and hope keeps people engaged.
Sharon, that was quite beautiful. Thank you. Brian, I gotta ask you, I'm gonna ask you, but what gives you hope in this space? You see some of the things that you see and you see some of the background, but really tell us about hope from your perspective.
Well, what gives me hope is people like Sharon and Richard and Shai and the other advocates and organizers that are out there who are not giving up and not backing down and continuing to raise this issue. What also gives me hope is the incredible ideas and innovation and solutions that community groups can come up with and present to decision makers. What also gives me hope is that we've got a mayor in Cavalier Johnson who is making this issue a top priority and wants to make great strides to reducing lead. And we also have great leadership in the Milwaukee Health Department and Waterworks who also see this issue as a critical priority, and lots of great staff here in the city and in, other allied organizations like Children's Hospital and other 16th Street Community Health Clinic and other healthcare providers that are working on this issue every day to make positive change.
Thanks, Brian. Michelle, when you think about all the things that are going on here, tell us from your perspective that about this idea of collaboration in the space. We know that not one organization can do it alone, but what does this collaboration mean to your organization and to others who are working in this area?
I think the collaboration is what everyone has been talking about. It's the organizers helping to push for policy changes that make a real difference, to help make sure that the funding is there so that we can do additional testing, we can remove additional lead service lines. I think, yeah, and of course it's those of us in government that are also trying to push things forward too, and not trying to hide things, but being honest about what the problems are and trying to address them in collaboration with the organizers.
Fantastic. Richard, I know you have so many stories and so many signs of hope. Can you point to one or two things that you could really have us end on that gives us that sense of hope in this space, and that it's not that people aren't forgotten here?
Mm-hmm. Oh, certainly. So as we all know, Medical College is working with 16th Street currently because DHS data shows that, in the neighborhoods that 16th Street Community Health Center has served, we've seen a reduction in lead poisoning. And we can attribute that to the hospital system that they have, working with the outreach program, working with the WIC clinic. So unfortunately, during the pandemic, WIC clinics were shut down, but are beginning to ramp back up. And we have learned so much from 16th Street as a community, but most importantly, Cole, in establishing itself as a nonprofit, the Cole Lead Safe and Healthy Homes Project is looking to replicate that effort on Milwaukee's north side. And through our very wonderful and grateful partnership with Children's Hospital to serve as the clinical partner and the medical partner for that, we want to go door to door in every household in 05 and 06 to begin with, so that we can give folks this face-to-face education. The idea is to begin with door-to-door education around lead in water, lead in paint, lead in soil. We are the Coalition on Lead Emergency, not the Coalition on Lead in Water or the Coalition on Lead in Paint, because we are trying to combat lead poisoning in any avenue that it comes through. So doing that door-to-door outreach in 05 and 06. As we continue to develop our program, we plan to ease into doing capillary blood testing on the doors. We plan to work with Milwaukee Waterworks to do water testing, sampling, and scheduling lead service line replacement. And then we also plan to connect folks with a medical home. So, the effects of lead are just tremendous in how many different physical or mental, deficits that it puts someone's body at. So our plan to make referrals so folks have a doctor to connect with, someone to get medical advice from that's a professional, is so important. It's so critical. When you look at the studies between lead poisoning and asthma, there's such an overlap. So that ability to have door-to-door education, being able to make strong referrals to hospital systems, also to the Milwaukee Health Department or SDC, so folks can get their home lead abated. Is so important. But there is still some capacity needs, and I think we have a great opportunity with the Wisconsin state budget cycle coming up, with the city of Milwaukee still deciding how to spend the remainder of its American Rescue Plan Act. Cole is calling for a public-private partnership to establish a lead safe and healthy homes fund that allows property owners to get resources to abate their home, so that we don't have to wait for a child to get sick or have to wait for the child to play the canary in the coal mine. And, after they get sick is when we act. So such good work happening, much to be hopeful for, and glad to have the opportunity to share about our work on this panel, Dr. Nelson.
Thank you all. We're really butting up against the time, and I hope you all will forgive me for a moment if I go a little bit past one, just to thank some of the people here, Richard and Shai and Brian and Sharon and Michelle. And I also want to thank some of our partners, SDC, Children's Health Alliance, my employer, the Medical College of Wisconsin, the Milwaukee Health Department, Milwaukee Waterworks, and Chicago Community Water Services. Without those partnerships, we would feel alone. But when we strive to work together, we can make a difference. As we say in some of our other work, this is not a sprint, but this is a marathon. So I hope you will join us next week when we talk about paint and lead in the soil. And so on behalf of our team, I want to thank you for joining this webinar today. Have a great afternoon, and we'll see you next week.